Glad to welcome everyone. I'm Dr. Vasyl Chaika, and today we'll be talking about blood thickening. Why does this situation occur? What diseases can this lead to? How can you prevent blood thickening, and what should you do if it has already happened? Watch this video until the end, and you'll get this sorted out once and for all. So, blood in our body performs a great many functions. It's a transport function because it delivers many nutrients. It's also a respiratory function because oxygen is delivered directly through it. It also regulates heat and so on. So what's important, and where do people often get confused? When we hear the phrase, "you have thickened blood," people start imagining that this liquid becomes thicker. For example, there's water, and when it starts to freeze, it becomes thicker. Or for instance, oil. Oil is thicker than water. And people start imagining it this way. And this is the main mistake. Why? Because our blood is not just water. Our blood consists of plasma, and plasma is a substance that is 90% ordinary water. And there are also proteins, salts, and so on, 10%. In this plasma, just like in soup where potatoes or pasta float, the formed elements float as well. These are erythrocytes, leukocytes, and platelets. So, blood is a mixture of erythrocytes, leukocytes, and platelets which float in the blood plasma. But here, people very often confuse the concept of blood density. You need to clearly distinguish this right away. Thickening of the blood once again happens either when the number of formed elements increases while the plasma level remains the same, or conversely, when the number of formed elements stays the same but the plasma level decreases. This is the key point. This is what is considered blood thickening, and the test that shows this is a blood test. There is an indicator called hematocrit, which is the ratio of the liquid part to the dry residue. But there is also such a concept as increased thrombosis. This happens, for example, when a blood vessel is injured and the bleeding needs to be stopped immediately. For this, there are specific proteins in the blood plasma that are released. They form a kind of mesh, and then the formed elements called platelets settle onto this mesh. In other words, they essentially seal the site and form clots there. You need to clearly distinguish once again between clot formation and blood thickening. Here is the difference between them. Which test shows increased clot formation? That's a coagulogram. Please do not confuse these two indicators. So for example, if we have a diagnosis like hemophilia, it doesn't mean the blood is thin. It's just that the blood can't clot because the protective factors that stop bleeding are absent in the blood. And conversely, there are other conditions in which the blood will clot very quickly. And this can lead to increased thrombosis. But this does not mean that your blood is thin or thick. So once again, blood thickening is when the number of formed elements increases. And one more tiny nuance. Formed elements can stick to each other, forming clumps. In the head, such conglomerates are called rouleaux. For example, erythrocytes stick together and become like rouleaux. What does this lead to? That now erythrocytes cannot perform their function. This is the transportation of oxygen. And then we experience oxygen deprivation. There is a very common myth that blood thickening leads to heart attacks and strokes, and that's why we need to thin the blood. But you need to clearly understand that thin blood is when the formed elements, first of all, float separately from each other and do not stick together, and secondly, there is a certain ratio between the formed elements and the plasma itself. The main question people always have is, how can I determine if I have thick blood or not? Maybe there are some specific symptoms. Some people say dry skin, others mention shortness of breath, some say your capillaries start to burst. That's thick blood. These are non-specific indicators. And these manifestations can occur with various kinds of changes, and they have absolutely nothing to do with blood thickening. Is it possible to detect thickened blood just by doing a blood test? Because often we come to the lab technician takes a blood sample and says, "Oh, your blood is thick, it clots very quickly." Blood clotting has nothing to do with thickening. It's also impossible to determine by eye whether your blood is thick or not. And often this is manipulated by showing such a test, that your blood should clot within 5 minutes. If it's thin, then that's bad. If it clots faster, that's also bad. But this doesn't tell you whether your blood is thick or not. It only shows how quickly your blood clots, and this is very often manipulated. So, in fact, the correct indicator that shows whether our blood is thick or not is the hematocrit. And now you can see the normal values for these indicators on the screen. But there's another very important point. This test does not show whether your cells are floating separately or sticking together. And to determine this, there is a specific test called a drop of blood under a dark field microscope. Laboratories, of course, don't do this test because everything is done on so-called dead blood. But we look at live so-called native drops of blood. And now, on your screens, you can see what blood should look like in its normal state. And here the following is an important element. You can see that some cells float separately, not sticking to each other. In the other image, you can see how they float in columns, almost like clumps. It is precisely this sticking together, these so-called rouleau formations, that leads to your blood properties deteriorating. And your, for example, erythrocytes can't carry oxygen. And then you develop a condition called oxygen starvation. And that's something you need to address. Let's figure out together what needs to be done so that our blood performs its functions and meets the proper parameters. So what should we do to prevent our cells from sticking together and to ensure that each cell performs its function? Please remember this. In order to prevent cells from sticking together, biology has come up with a very simple mechanism. Blood cells, specifically erythrocytes, have a membrane on the outside, and on its surface there are negative charges. If you take two poles of a magnet with the same charge and try to bring them together, what happens? They repel each other. This is the biological way to prevent our blood cells from sticking together and to keep our blood from becoming what is called thick. Who ensures this indicator? Who gives these negative charges to the erythrocytes? This is ensured precisely by the blood plasma. And here's an interesting point. Our blood plasma has a negative charge. Normally, blood plasma has a charge of minus 75 millivolts. That is, the blood plasma constantly gives these negative charges to our erythrocytes, to our blood cells, and they do not stick together. Therefore, in order to have healthy blood, we need to help the plasma maintain its properties. And since our plasma consists of water, the best product that helps us keep our blood fluid is water. Only water has this property. But this water must have very specific characteristics. Let's now discuss what these characteristics are. So the first characteristic is the amount of salts dissolved in the water. What does this mean? The fewer salts, the better it is for us. Because if we drink water that, for example, contains a lot of salt, then a lot of fluid will be retained in our body, which is also not very good for us. And in this case, the water you drink daily should contain a total amount of salts of no more than 300 milligrams per liter, or 300 milligrams per deciliter. The optimal amount is 150, and the minimum is 50 milligrams per liter. In addition, a specific indicator here is the calcium content or the hardness of the water. Therefore, the calcium in the water should be between 5 and 20 milligrams per liter. The maximum allowable amount is 50. If you take a look at these waters, which are very popular here and are constantly advertised to us, for example, in sanatoriums or when someone wants to improve their health, you will be absolutely shocked because the total hardness there is not just measured in milligrams, but in grams, 8, 10, even 12 grams per liter. In other words, the water is very hard. As a result, we will disrupt our natural properties, particularly those of plasma. Another important point is that water should have the appropriate pH or acidity level. Normally, the pH of our blood is 7.36. Therefore, the water we consume should have a pH of 7.5, at most 8. That is so that we provide support. But the water we mostly drink, for example, bottled water or even tap water, usually has an acidic pH. In other words, we are acidifying our bodies. And this should not be done. Another important parameter is that the water you consume should be warm. Why? Because when you drink warm water, it is quickly absorbed, it doesn't stay in the stomach, and it doesn't need to be heated in the stomach. And this means you can quickly help your blood plasma. So how much of this water should you drink? And where can you get this water? How can you make it yourself? So first of all, in order for us to be able to drink this water regularly and keep our blood thin without any medications, we need to consume water that meets certain parameters. For example, if you have a reverse osmosis filter installed and you use it at home and you see these water parameters at the output, you can safely use this water. But if you have had your water analyzed and according to these indicators, the laboratory results are not suitable, for example, the water is very hard, what should you do? You need to get a water filter specifically designed to remove hardness. So remember, neither the name holy water nor the label holy water matters. Neither coral water, nor miraculous water, nor meltwater. These are just words. The water must meet these specific parameters. And so if you drink this kind of water throughout the day, your blood will be restored. So how much of this water should you drink? Maybe you drink a liter, maybe 2, maybe 5, or maybe the more the better? No. The optimal amount of water you should drink is the amount at which your urine becomes clear. For some, it will be 50 milliliters. Thank you. For someone else, it might be 100 every hour. So basically, how do you determine this? You take every hour throughout the day until 5 p.m., initially 50 milliliters of water each time. The temperature should match the parameters you observe. Next, if your urine does not become clear during the day and remains intensely colored, yellow or otherwise, this means that the amount of water you are drinking is too little. You should increase it by 25 milliliters and start drinking 75 milliliters at a time. 5. If that's still not enough, drink 100 milliliters at a time, each time. In this way, you will establish the optimal water intake for yourself. And then you can maintain your blood plasma and, of course, your blood in a liquid state. Does this work? Once again, please take a look at this video, which shows how water helps if you drink it regularly. This video shows another very interesting point. For example, how medications act on the blood. They do not make the blood liquid. They just break up these coin stacks. The ones that form, they simply crush them. But the cells still remain stuck together and they do not perform their function. Because only when an erythrocyte has that rounded shape, when it doesn't stick to others, does it transport oxygen 100%. But if they stick together, their transport function decreases 5-fold. And what will this lead to? To oxygen deprivation. Are there any foods that thin the blood? Of course, you may hear a lot of different names. But it's water, and only water, that really helps. All the others have a very, very minor effect. That's why, as they say, there's a saying, without water, you can't go here or there. Use the right water and you'll choose to have healthy blood. This was Dr. Vasyl Chaika with you.